Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2016, 2018, 2022, and current clinical trials. Today we're continuing on with a cognoscopy, Dr. Bredesen's evaluation to screen for all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important lab marker fasting glucose. Next up, we're coming over to hemoglobin A1c. Well, what is hemoglobin A1c, or HbA1c as it's commonly referred to? HbA1c is a blood test that reflects a person's average blood sugar levels over the past 2 to 3 months. It measures the percentage of red blood cells that have glucose attached to them, indicating how well blood sugar has been controlled. It provides a long-term view of blood sugar management, helping doctors diagnose diabetes and prediabetes. Standard of care currently views any lab value below 5.7% in the normal range. Levels between 5.7 to 6.4% are considered prediabetes, and HbA1c levels above 6.5% is typically used to diagnose diabetes. Now, even though standard of care views anything below 5.7% to be within the normal range, Dr. Bredesen and his team have seen optimal cognitive health and function with HbA1c levels below 5.6%, ideally 5.3% or below. This is the range Dr. Bredesen recommends for prevention and reversal of cognitive decline. Hemoglobin A1c doesn't tell us everything, but it is a good marker for our overall metabolic health. And even if prediabetes or diabetes has not been diagnosed, if this marker is outside the optimal range, it typically points to the state that precedes these conditions, which is insulin resistance. For optimal cognitive health, we're going to need the opposite of that state. We're going to need insulin sensitivity. Dr. Bredesen considers reversing insulin resistance and restoring insulin sensitivity to generally be the most important factor in helping patients prevent and reverse cognitive decline. Go to episode 84, linked in the description below, if you want to learn a little bit more about insulin resistance and fasting glucose. But long story short, insulin resistance leads to metabolic dysfunction, diminished cellular energy production, and inflammation. Our brains are especially sensitive to insulin resistance and this shortfall of energy, as they are on average only about 2% of our total body weight, but consume anywhere between 20 to 25% of our total daily energy intake. In fact, our brains can start to become insulin resistant before a lab marker starts showing outside the normal ranges. Diminished energy supply for the brain leads to diminished cognitive function. There are good reasons and very good studies that demonstrate why Alzheimer's has been more and more referred to as type 3 diabetes. A study in 2017 followed 8,800 participants aged 50 and older for 2 years and showed elevated hemoglobin A1c levels in the diabetic range were associated with a 10% faster memory decline in those 2 years. Mechanism: chronic hyperglycemia, chronic high blood sugar levels, increased inflammation, accelerated aging, and damaged the microvasculature of the brain, leading to cognitive decline. I've linked this study below so you can check it out. Dr. Bredesen has found that insulin resistance is the single most important metabolic contributor to Alzheimer's disease development and progression, and that the biggest drivers that cause insulin resistance for us are diets high in simple carbohydrates such as sugar, processed food full of high fructose corn syrup, sedentary lifestyles, poor sleep, and chronic stress from work and home lives. But he also found that the antidote to reversing insulin resistance and restoring insulin sensitivity was optimizing the right diet, exercise, sleep, and stress management programs within patients' protocols. These are the core pillars of the ReCODE protocol. Again, Dr. Bredesen's optimal hemoglobin A1c blood lab range is below 5.6%. And the biggest lever in achieving this level of insulin sensitivity is what we eat every day. To learn more about this, please check out episode 16, linked on the screen and in the description below for a brief overview of Dr. Bredesen's anti-Alzheimer's diet. I've also linked all of Dr. Bredesen's recent studies in the description below. And I'd love to hear from you. Has your neurologist ever spoken to you about hemoglobin A1c levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve, and please like and subscribe as it helps our community grow. And remember, I'm not a doctor, I don't have a PhD, I'm a caregiver and citizen researcher on the ground helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.